The three parts are as follows: hotel quarantine, testing, and enforcement. First, Mr. Speaker, we're setting up a new system of hotel quarantine for UK and Irish residents who've been in red list countries in the last 10 days. In short, this means that any returning residents from these countries will have to quarantine in an assigned hotel room for 10 days from the time of arrival. Before they travel, they'll have to book through an online platform and pay for a quarantine package costing £1,750 for an individual travelling alone, which includes the hotel, transport, and testing. This booking system will go live on Thursday, when we'll also publish the full detailed guidance. Passengers will only be able to enter the UK through a small number of ports that currently account for the vast majority of passenger arrivals. When they arrive, they'll be escorted to a designated hotel, which will be closed to guests who aren't quarantining for 10 days or for longer if they test positive for COVID-19 during their stay. We've contracted 16 hotels for an initial 4,600 rooms, and we will secure more as they are needed. People will need to remain in their rooms and, of course, will not be allowed to mix with other guests, and there'll be visible security in place to ensure compliance alongside necessary support, so even as we protect public health, we can look after the people in our care. Second, Mr. Speaker, we're strengthening testing. All passengers are already required to take a pre-departure test and cannot travel to this country if it is positive. From Monday, all international arrivals, whether under home quarantine or hotel quarantine, will be required by law to take further PCR tests on day 2 and day 8 of that quarantine. Passengers will have to book these tests through our online portal before they travel. Anyone planning to travel to the UK from Monday needs to book these tests, and the online portal will go live on Thursday. If either of these post-arrival tests comes back positive, they'll have to quarantine for a further 10 days from the date of the test and will, of course, be offered any NHS treatment that's necessary. Any positive result will automatically undergo genomic sequencing to confirm whether they have a variant of concern. Under home quarantining, the existing test-to-release scheme, which my right honourable friend, the Transport Secretary, has built so effectively, can still be used from day 5, but this will be in addition to the 2 mandatory tests. The combination of enhanced testing and sequencing has been a powerful weapon through this pandemic, and we'll be bringing it to bear so we can find positive cases, break the chains of transmission, and prevent new cases and new variants from putting us at risk. Third, Mr. Speaker, we'll be backing this new system with strong enforcement of both home quarantine and hotel quarantine. People who flout these rules are putting us all at risk. Passenger carriers will have a duty in law to make sure that passengers have signed up for these new arrangements before they travel and will be fined if they don't. And we'll be putting in place tough fines for people who don't comply. This includes a £1,000 penalty for any international arrival who fails to take a mandatory test, a £2,000 penalty to any international arrival who fails to take the second mandatory test, as well as automatically extending their quarantine period to 14 days, and a £5,000 fixed penalty notice, rising to £10,000 for arrivals who fail to quarantine in a designated hotel. We're also coming down hard on people who provide false information on the passenger locator form. Anyone who lies on the passenger locator form and tries to conceal that they've been in a country on the red list in the 10 days before arrival here will face a prison sentence of up to 10 years. These measures will be put into law this week, and I've been working with the Home Secretary, the Border Force, and the police to make sure more resources are being put into enforcing these measures. I make no apologies for the strength of these measures, because we're dealing with one of the strongest threats to our public health that we've faced as a nation. I know that most people have been doing their bit, making huge sacrifices as part of the national effort, and these new enforcement powers will make sure their hard work and sacrifice isn't undermined by a small minority who don't want to follow the rules. Mr. Speaker, in short, we're strengthening the health protection at the border in 3 crucial ways: hotel quarantine for UK and Irish residents who visited a red list country in the past 10 days, and home quarantine for all passengers from any other country. a 3-test regime for all arrivals, and firm enforcement of pre-departure tests and the passenger locator form. Our fight against this virus has many fronts, and just as we're attacking this virus through our vaccination program, which is protecting more people each day, we're buttressing our defences against these vital measures so we can protect the progress that we've worked together so hard to accomplish. And I commend this statement to the House.
I'm now going to call the Shadow Secretary of State, Jonathan Ashworth.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. And I again start by congratulating all involved in the vaccination rollout. Vaccination needs to reach everyone, and we need to drive up those vaccination rates amongst the over 70s. There have been some reports today that over 70s have been ringing up to get an appointment, but the NHS computer systems are not yet ready to accept appointments over the phone. Could he look into that for us? And what is the plan also to drive up vaccination levels in minority ethnic communities? I'm sure he's as worried as I am about the vaccination rates amongst diverse communities. I know the government announced some funding for local authorities to tackle vaccine hesitancy in minority ethnic communities, but a city like Leicester, mine, one of the most diverse in the country, was not on the list. Can he rectify that? At last night's press conference, he said that the way we deal with new variants is to respond to them as they arise. The first line of defence is to identify and stop spread. But our first line of defence is surely to do everything we can to stop them arising in the first place. That means securing our borders to isolate new variants as they come in. He's announced a detailed package today, but he hasn't announced comprehensive quarantine controls at the borders. So why then, when over half of countries where the South African variant has been identified, why are over half of them not on the so-called red list? And indeed, according to newspaper reports, he wanted to go further with more extensive quarantine arrangements. I want that as well. The British public want that as well. So I will work with him to make that happen so that we can strengthen our borders and fix any holes in this nation's defences. Now, as he knows, mutations occur as long as the virus can replicate and transmit. And the greater the spread, the greater the opportunity. We have the South African variant. We have the so-called E484K mutation in the B117 strain has been identified as well. But isn't the cold reality that the virus is now here for some time? And therefore, for vaccines to succeed in protecting us, we need to do more to protect those vaccines by cutting transmission chains and spread, especially when lockdown eases. Now, last year, the Secretary of State said, in launching Test and Trace, that it would help keep this virus under control while carefully and safely lifting the lockdown nationally. But it didn't keep the virus under control, did it? So how will it be different this time? Will retrospective test tracing, the enhanced tracing he's outlined for areas where there are variants, will that be routine everywhere? And extra testing where there are variants is, of course, welcome. But for many who can't work from home on Zoom calls and laptops, who are poor or low paid, who live in overcrowded housing, or perhaps are care workers who are currently using up their holiday entitlement when sick, so not to lose wages, a positive test is not just a medical blow, but a financial one as well. Last Tuesday, he boasted of the £500 payment, yet over 70% of applications for financial support are rejected. By Wednesday, his own head of Test and Trace was pointing out that 20,000 sick people a day don't isolate. And indeed, 2 months earlier, Dido Harding had already said, people are not self-isolating because they find it very difficult. They need to keep earning and feed. The need to keep earning and feed your family is fundamental. So is it any wonder that infections are falling at a slower rate in the most deprived communities? We need that financial support that his own scientific advisors have called for, has been shown to work internationally. But if he thinks I am wrong, can he tell us why he thinks Dido Harding is wrong? Secondly, we know this virus can be transmitted through aerosols. Has he looked at installing air filtration systems in public buildings such as schools? And given concerns that the new Kent variant may shed more viral load through coughing and sneezing, will he update the guidance on face masks, as Germany has done, with FFP2 masks on public transport and in shops? And will he ensure higher grade PPE for frontline NHS staff becomes a requirement, as the BMA, RCN and unions have called for. Finally, Mr. Speaker, next week is Children of Alcoholics Week, a cause that is very close to my heart, Mr. Speaker, and indeed I'm going to be running the London Marathon again to raise money for an alcoholics charity, if it's on. I'm looking forward to the Secretary of State assuring me that it's going to be on, and perhaps he can run it with me. But the excess deaths from liver disease from this pandemic are up 11% in the pandemic. It's a huge increase in excess deaths from liver disease. And many children are in lockdown in homes under the shadow of alcohol abuse. We look at providing more support for those organisations that are helping children through this difficult time of lockdown who are dealing with parents with substance misuse problems.
Thank you very much, Mr. Speaker. And I was listening very carefully to the Honourable Gentleman, and I think I take that as support for the measures that we're bringing in. On the specific points that he raises, he's absolutely right that further driving up vaccination rates is critical. I'm delighted by the vaccination rates and the uptake of over 90% in all of the groups over the age of 75, and rapidly rising, now above 75% in the 70 to 74s, and rising fast. So I agree with him very strongly on the need to keep driving up the uptake of the vaccine, and the Minister for Vaccine Deployment, Minister Zahawi, is leading the efforts across with the NHS and local authorities to try to make sure that we can increase vaccination rates further. But nevertheless, this take-up has been absolutely superb so far, and there's still more to do. I'll absolutely look into the points that he made about Leicester. I know that it's close to his heart and a very important matter. I'll also commit to him to keeping the red list up to date. It is important that we take the measures that are necessary to protect this country. There are countries around the world on a so-called green list that have very, very low rates of infection and no known variants of concern. So I'm absolutely in favour of keeping the red list up to date. But I also think that it's important that we're proportionate when there are countries that do not have a record of variants of concern. However, we will use the fact that we'll sequence every positive test from somebody who comes through the border as a global system of vigilance to make sure that we are always looking for those variants of concern. He raised the issue of financial support, and I reiterate the point that the £500 support is available for anybody on low incomes, so people should come forward for testing in all circumstances. And I'm absolutely delighted at the level of testing as well, where there's now an average of over 650,000 tests a day done in this country, which is obviously a very, very substantial number. He raised the point about air filtration systems, which are important, and I'll point him to guidance from the business department on air filtration systems, and on PPE, where we have taken clinical advice and follow the clinical advice on the correct levels of PPE. And finally, I know that the issue of children of alcoholics is very close to his heart and many colleagues across this House. So I will absolutely look at how we can ensure that the extra funding that we have provided in this space it continues to support the vital work of those, not just in the NHS, but also especially charities who do so much in this space. The invitation to run the marathon with him, Mr. Speaker, is a very interesting one. I'm not sure I've got enough time for training this year, but it's certainly something I'd like to do at some point in the future.
Let's head to the chair of the Select Committee with Jeremy Hunt. Jeremy Hunt.
Thank you, Mr. Speaker, and I strongly support the new measures. The higher the number of new daily cases, the more opportunities for variants and mutations to emerge, including ultimately some that may be immune to the vaccine. So does the Health Secretary agree that the central priority now must be to bring down the number of new daily cases? And as we do that, is he planning to introduce enhanced contact tracing for all new cases, including Japanese-style backward contact tracing and genomic sequencing of every new case?
Mr. Speaker, we have the biggest genomic capacity in the world by some margin. And when the number of cases comes down, as our genomic capacity continues to expand, and we plan to more than double it in the coming months, then I hope to get to the position where we can genomically sequence every positive case. Yes, but we're not there yet. The strategy that I outlined to tackle new variants, of which the border measures is an important part, is itself one part of the 4 conditions that the Prime Minister set out for when we can lift measures. The other 3 being the successful rollout of the vaccine, which is going very well, the fall in the number of hospitalizations and the fall in the number of deaths, both of which, as I said, are moving in the right direction, but still too high. And therefore, this strategy to tackle new variants is crucial, and the number of cases is a factor because it itself determines the number of new variants. But the conclusion of all of that is that we must all stick to the rules now, and the more that we stick to the rules now, the sooner we can get out of this.
Let's head to SNP spokesperson in the North with Martin Day. Martin Day.
Thank you, Mr. Speaker. The South African variant is a sure warning sign of the risk from other mutant strains which may be out there. When combined with the question mark over vaccine efficacy with this variant, it is clear why we need effective border restrictions. So can the Secretary tell me why there are 35 countries where the South African and Brazilian variants are present and are not on the quarantine red list? Does the government have a plan to redress this gap? Now, from a government obsessed with taking back control over its borders, this omission is surprising. The Prime Minister has previously said that the UK cannot emulate other island countries such as New Zealand or Australia in preventing all unnecessary travel into the country due to the amount of food and medicine the UK imports. Today's change of heart is indeed welcome. Can the Secretary confirm how these measures will keep the flow of goods and those transporting them open while restricting travel not related to import and export of goods?
Thank you very much. Well, the measures I've outlined today relate to passenger travel. There is, of course, a testing regime already in place for accompanied freight. And there is a difference between this country and Australia and New Zealand, and that is that accompanied freight is a significant proportion of our daily imports, including just-in-time delivery, for instance, of food. Whereas for islands that are further away from a continent, then unaccompanied freight is a much, much more significant proportion of their international imports. So we have to take these practical considerations into account. As I said, Mr. Speaker, we keep the red list of countries under review, and the extra testing measures that I have outlined today will help us with that vigilance so that we can see where variants of concern are and to what degree they're present in other countries around the world.
Said, remaining in the North with Peter Gibson. Peter Gibson in the North East.
Thank you, Mr. Speaker. Can I thank my right honourable friend for his announcement today? The people of Darlington and right across the North East have made incredible sacrifices to tackle this virus. And I know that they will welcome the tough measures he has announced for those who seek to avoid quarantine. Does he agree with me that it is mass testing, vaccination, following the rules, and tough sanctions for those who break the rules that will help us to tackle this virus?
I got it. Thank you very much. I agree with my honourable friend that it is a combination of the mass testing, the vaccinations, and the tough enforcement that is not only right to deal with this virus, but as he says, it is fair for people who are doing the right thing. And that is why I think the enforcement measures to ensure that everybody follows the rules, because this virus attacks us all as humans, and it doesn't treat people differently just because they're better off and might be able to fly to Dubai for the weekend. It treats us all the same, so we should treat people the same. And I think that is one of the reasons that it is important to bring these measures in with strong enforcement so that they are both tough and fair on people who are working so hard and sacrificing so much to follow the rules.
To Penarth with Stephen Doherty. Stephen Doherty.
Thank you, Mr. Speaker. I simply don't understand the logic being used for the red list, with countries where dangerous variants present not included, and multiple backdoors left open. I've watched passenger flights over the last few days, including a flight from Peru on the red list, currently en route to the Netherlands, which isn't on the red list, but has substantial connections to the UK, and flights from countries in southern African red list countries en route to hubs in Addis Ababa, Nairobi, and so on, again with substantial onward connections to the UK, but who aren't on the red list. We've even heard about UK troops in Kenya testing positive for COVID today. So will the Secretary of State publish the epidemiological data that's being used to take those decisions on which countries are included, and urgently review some of the very serious inconsistencies that exist?
Thank you very much, Mr. Speaker. The honourable gentleman raises an important point, and these points are addressed in what I've just announced in two ways. The first is that anybody who has been in a red list country in the past 10 days must declare it on a passenger locator form, and to fail to do so is going to be an imprisonable offence. And of course, if nobody can come directly from a red list country anyway, because those flights have been stopped. And this is a critical part of the enforcement of this system. In addition, the second point he raises is important, which is that there are some countries where a variant of concern is the dominant variant, including in, for instance, Southern Africa and in parts of Brazil. There are other countries where there are very small numbers of variants of concern, in the same way that here in this country, thankfully, there are very, very small numbers of variants of concern. So absolutely, we publish information on a very broad scale, but we have to make these the judgments on what's on the red list, and we'll keep it under review. The final point I'd say is that different countries have very different levels of genomic sequencing. There are some countries, even developed countries, that have very low levels of genomic sequencing. We offer to support all countries around the world to make, if they want a sample sequence, then we will do it for them in order to help with this vigilance. But the mandated testing arrangements that we've introduced today will help ensure that we can strengthen the epidemiological data on which the judgments about the red list are taken.
Let's head to the southwest with Selene Saxby. Selene Saxby.
Thank you, Mr. Speaker. Cases here in North Devon are now down to just 25 per 100,000. What reassurance can my right honourable friend give that when the time comes to unlock, the hard work of the people of North Devon will not be undone by an influx of visitors either from home or abroad with new variants? And are options being looked at for local unlocking to enable schools to reopen and some local businesses to restart, given the very low level of community transmission here?
Thank you very much, Mr. Speaker. I'm delighted to see that there are some parts of the country where the case rate really has come down a long way, down to 25. It is important for us to make sure that we get these levels down across the country. And we've seen before that when there are areas that are low, there is spread from elsewhere in the country. Actually, the experience of last summer was that tourists travelling to go on holiday within the UK did not contribute to an increase in levels. It was when levels elsewhere got really much higher that we then saw the transmission to other parts of the country. Those judgments that will inform the roadmap proposals that the Prime Minister will set out on the 22nd of February. I wish I could say more in more detail to my honourable friend, but it's for the Prime Minister to set out later this month.
Remaining in the southwest with Karen Smith. Karen Smith.
Thank you, Mr. Speaker. The news of the new mutation is obviously of great concern to the people of Bristol, but they have locally, the public health officials have rapidly set up new testing centres, and today new 5 drop and collect testing centres. It is a massive effort locally. Hundreds of people have come forward voluntarily since Sunday to be tested. Will the Secretary of State join with me to thank those public health officials locally here in Bristol and the people who have come forward, and join with me in encouraging more people in those areas that have been identified, those postcoded areas, to come forward for this surge testing to help us understand this virus better?
Mr. Speaker, I agree with every word that the Honourable Lady has said, and this is an incredibly important effort by the people of Bristol, especially the postcodes that were identified. And I want to thank all the public health officials at Bristol City Council and more broadly, including the South Gloucestershire, and say to them that the work they're doing to tackle the variant of concern where it is found, even though the numbers are small, we want to tackle every single one that we find and really get this under control. As you can see from this exchange, Mr. Speaker, and as everybody in Bristol can see, this is a cross-party, cross-community effort in which everybody has a part to play, and I thank the Honourable Lady for her leadership.
Let's head to the West Midlands with Suzanne Webb. Suzanne Webb.
Thank you, Mr. Speaker. I welcome the statement today, and I am so proud of all my constituents across Stourbridge, Craigenlie, in the way they have fully understood and taken on board that we all have our role to play in defeating this virus. Does my right honourable friend agree with me that the constant flip-flopping and reliance on hindsight by the party opposite is nothing more than seeking to only score political points rather than reinforcing the government's message that we all have a part to play to defeat this virus? And those on the opposite benches would be well served following the fine examples set by my constituents.
I think that what the public want to see in Stourbridge and across the whole United Kingdom is people working together to defeat this virus. Some of the measures have to be tough and some are difficult, but it is all done with the goal of getting this country through this as well as we possibly can, so that we can lift as many measures as soon as we safely can. And that balance between pace and safety is absolutely central to the judgments ahead. I want to thank everybody in Stourbridge and say to them, there is no politics in this. The only thing that's important is the safety of the people of Stourbridge.
Let's back to London with Rushan Narali. Rushan Narali.
Thank you, Mr. Speaker. I'm grateful to all those working together, the GPs, Queen Mary University, the Royal London Hospital, Tower Hamlets Council, the London Muslim Centre and others in my constituency to make sure people get vaccinated. But vaccine take-up, as you've heard, is lower among minority communities and some other vulnerable groups. 77% of white residents are getting vaccinated, which is great, but only just over half of Asian and under 46% of Black residents in our borough are getting vaccinated. So can the Secretary of State commit to increasing the supply of vaccines to our GP surgeries, as they are saying that this is where they can make a big difference with vaccine take-up? It would make a big difference to the death rates and the dangers that these minority communities face in my constituency and elsewhere in the country.
Secretary of State.
Mr. Speaker, I want to praise the Honourable Lady for the leadership that she is showing locally in driving up those vaccination rates. The fewer people who are left unprotected by the jab, the safer we will all be, both individually and in communities in London and across the country. My honourable friend, the Minister for Vaccine Deployment, Minister Zahawi, is leading the efforts in this space, and I'll make sure that he gets in contact so that we can work together to reassure everybody that the vaccine is the right thing for you and the right thing for your community.
You, Merriman.
Thank you, Mr. Speaker, and can I welcome the rollout of the vaccine programme. It's been a great success, and I congratulate the Secretary of State. Can I just ask for a bit of clarity on the statement? Firstly, the Secretary of State states under the home quarantine, the existing test release scheme can still be used from day 5. Does that mean that somebody can successfully test day 5, they would test negative, are then free to interact in the community for those 3 days, still have to take another test at day 8, in which case, if they fail that test, they have to quarantine again? That's the clarity. And secondly, how long is this likely to last for? Obviously, the summer travel is so important to the aviation industry. Is this just to last until we've vaccinated 99% of the mortality risk, which should be by May, or is it until we tweak the vaccination, in which case this could really have an impact on the aviation industry.
Thank you very much. On the first point of clarity he seeks, he stated the position exactly correctly. On the second point, we want, of course, to be able to exit from this into a system of safe international travel as soon as practicable and as soon as is safe. Professor Van Tam last night set out some of the details that we need to see in the effectiveness of the current vaccines on the variants of concern in order to have that assurance. And if that isn't forthcoming, then we will need to vaccinate with a further booster jab in the autumn, on which we're working with the vaccine industry. These are the uncertainties within which we are operating, and hence, for now, my judgment is that the package that we've announced today is the right one.
Let's head over to Munira Wilson. Munira Wilson.
Thank you very much, Mr. Speaker. Many of us have been urging the government for about 12 months now to take stronger action at our borders. So these measures announced today are very welcome, but ministers have been consistently slow on this issue. With the ONS estimating today that tragically COVID deaths in the UK have now surpassed 125,000, how many of those deaths does the Secretary of State believe could have been prevented by imposing much stricter public health measures at our borders since last March?
Well, we've had significant measures at the border throughout, and the new, stronger measures are necessary because of the arrival around the world of new variants of concern at the same time as the vaccine rollout is progressing successfully. And we don't want the very successful vaccine rollout to be undermined, and therefore it's reasonable to take a precautionary approach to international travel now, whilst we assess the effectiveness of the vaccines, which we are clear they have some effectiveness. The question is a matter of the degree, and that is currently being tested right now.
Let's head to Neil O'Brien. Neil O'Brien.
Thank you, Mr. Speaker. Given the incredible success of the UK vaccination programme, it would be terrible to put at risk our opening up by importing new variants like those seen in Brazil. So will my right honourable friend stand ready to further tighten up the measures at the border and the enforcement of quarantine? And does he agree with me that if we want to see rapid opening up, as we all do, then we should be supporting strong measures at the border?
My honourable friend is right that, firstly, we must keep the red list under review. But secondly, this crucial point that strong protections at the border are part of defending and safely allowing the domestic opening up. And for those of us who want to see that domestic opening up, ensuring that we have protection from from variants that might arise from overseas is an important part until we can get to a position where we can be confident in vaccine efficacy against all variants, not just against the current variants that are here in large numbers in the UK.
Let's head to Northern Ireland with Jim Shannon. Jim Shannon.
Thank you, Mr. Speaker. Can I also put on record my thanks to the Secretary of State for all that he and his team are doing in relation to this. Northern Ireland is the only part of the United Kingdom with a land border. As the Secretary of State is aware, the Republic of Ireland are enforcing the very apparent border in Northern Ireland for their safety on their side. It seems, as I said, there can be a border when it suits. However, I am eager to understand what steps have been taken to ensure again, as I highlighted last week, that the officials in government have access to pertinent travel information for those coming into Dublin to ensure that the United Kingdom on the Northern Ireland side is also safe. Thank you.
Thank you, Mr. Speaker. I spoke to my Irish opposite number, Minister Donnelly, this morning, and he has assured me that data will be provided appropriately and securely, and we've been working together to ensure that happens for some time. As I said in my statement, we've been working with the Irish government to ensure that there are appropriate measures both in the Republic of Ireland and in the United Kingdom to ensure that the border on the island of Ireland can be kept completely open, as it must, yet we have the adequate protection against arrivals of variants of concern internationally. And it is the two countries working together, putting in place similar arrangements, both in the Republic and in the United Kingdom, that will allow us to deliver that goal that I'm sure we all share.
Thank you, Mr. Speaker. I am increasingly concerned about the effect of lockdown on the mental health of children. I am receiving so many emails from adolescents and teenagers. Will my right honourable friend assure me that when he feeds into the February the 22nd roadmap, that the mental health of children and indeed their parents is taken into account?
Yes, of course I will, Mr. Speaker.
Right, let us head to Wales with Howell Williams. Howell Williams.
Thank you, Mr. Speaker. Yesterday, the number of deaths from COVID in Wales passed the grim total of 5,000. Our public health leaders say that the Welsh Government's £500 self-isolation payment is not enough and is indeed an economic driver for people to go to work. Sick pay, on the other hand, is the responsibility of this government. So will he now commit this government to increasing the paltry level of sick pay at just £96 per week to enable working people to self-isolate safely?
Well, Mr. Speaker, we have put in place the extra £500 for those on low incomes to ensure that everybody can get financial support that they may need whilst self-isolating.
Let's cross over to Peter Alders. Peter Alders.
Thank you very much, Mr. Speaker. I commend my right honourable friend for his statement. The Norfolk and Waveney CCG, local NHS staff and volunteers are to be commended for rising to a challenge which on Sunday resulted in 1,000 people being vaccinated at Kirkley Mill in Lowestoft in very difficult weather conditions. There is a plan to significantly increase the number of daily vaccinations for more sites. And so that this can be delivered, can my right honourable friend confirm that there will be a consistent and increased supply of vaccines and that the initial difficulties that some people have experienced with the national online booking system will be ironed out?
Yes, absolutely. I want to thank everybody across Norfolk and Waveney for the work they've been doing to roll out this vaccine. As a critical part of the country in terms of the COVID response, the work that's been done locally has been absolutely exemplary. And I commend my honourable friend for the part that he's played and the leadership he's played in Lowestoft in making that happen. The uptake has been superb. I've seen some of the reports locally and the emotional impact it has on people to get vaccinated is absolutely fantastic. And I'll absolutely take away the points that he makes.
Let's head up to Yorkshire with Judith Cummins. Judith Cummins.
Thank you, Mr. Speaker. Despite assurances by the Secretary of State and the Minister, it is now clear that the newly imposed NHS dentistry targets are in fact actively undermining patient access to urgent treatment during the pandemic, as I warned they would. Last week, a whistleblower at the UK's largest dental chain with over 600 practices, My Dentist, sent me an internal memo that advised them to prioritise routine checkups over treatments in order to meet the new targets. So will the Secretary of State look at this urgently and agree to revise these targets to ensure that they do not undermine patient care, as currently the system as it stands incentivises routine checkups above those in severe pain?
Thank you very much, Mr. Speaker. I want to thank our nation's dentists who've worked incredibly hard to get dentistry services going again. It is very important that we support them and that the financial incentives underpin the need to restart as much as is possible. It is, of course, challenging to deliver dentistry services with given that there are so many aerosol generating procedures. And I will ask the Dentistry Minister to speak to the Honourable Lady and perhaps meet with her to discuss these ongoing challenges.
Let's head down to Henry Smith. Henry Smith.
Thank you very much, Mr. Speaker. I support the introduction of targeted quarantine for those passengers coming from high-risk COVID-19 variant countries. But will he also commit to regular reviews and even a sunset clause on these regulations as later in the year we seek to get our economy restarted and support our aviation sector?
Mr. Speaker, I don't underestimate the impact that all of these measures have had on Gatwick. And as the honourable gentleman represents so many of those who work at Gatwick, I understand the impact. I was at Gatwick Airport on Friday, and to see the empty departure hall was really quite a sad sight. These measures are necessary in my view, and I'm glad that he supports them, difficult as they are. But we are also acutely cognizant of the economic impact on the airports, and of course the impact on those who work in them. And I'd be very happy to keep talking to him about how quickly we can remove these measures safely.
Let's go over to Diane Abbott. Diane Abbott.
Thank you, Mr. Speaker. I mean, the whole House has welcomed what the Secretary of State has had to say about the progress in fighting coronavirus. But he will be aware that there is a very real danger that one cohort will be left behind, and that is Black and ethnic minority communities. We already know that Black people were 4 times more likely to die from coronavirus, and currently the statistics show that Black over 80s are half as likely to be vaccinated as white people. I'm conscious that the vaccine minister, Nadhim Zahawi, is aware of this issue, but will the Secretary of State give the House an undertaking that he will drive forward a whole series of measures in order to increase vaccine take-up amongst Black and minority ethnic persons? It would be a tragedy when Black and minority ethnic people are on